Hello and welcome, everybody. This is our YouTube channel for Mindcast, and today we are going to discuss about neurodiversity, neurodisabilities, and create awareness. We also have Prathyusha with us. She's a psychiatrist. She's also a therapist, and she expertises in this domain. Prathyusha, do you want to go ahead and give a brief introduction about yourself?
Hi, I'm Dr. Prathyusha Mikkilineni. I'm the founder and consultant psychiatrist of Infinity the Mind Clinic in Kokapet. So I have done my MBBS and MD psychiatry from one of the prestigious institutes in Tamil Nadu, and right now practicing at Hyderabad.
Oh, awesome. That's some CV actually. Very tough to follow that up. Glad I gave my introduction before you. Awesome. Yes. Dr. Prathyusha, we'll have very basic questions. Okay, today. It will be the questions from public, like people like us who have no knowledge about this domain would be asking some very basic questions that are just directly coming from public, right? So I think we can get started here, and the format that we're going to follow is we are going to pick up stages from right from when the child is born, or maybe even before that, to when he grows up and then has a particular disability, and then their parents, how they cope up with it, and then how we can spread awareness and make life more easy, and as our motto says, right, create a more neuro inclusive world, right? So that is how the format is going to be. Now, one thing that comes into my mind always is, like, if I had a child, right? If I'm obviously going to get married in probably 2 years or 3 years from now, and if, let's say, if I'm planning to have a child, the first thing that I would want to do is to check if the child that is going to be is free from any neurodisability, if there are any, and even before taking that decisions, if we as parents can check ourselves and see if there's a possibility. So yeah, Dr. Prathyusha, I mean, anything on that lines, like how we can proactively see what can happen to a child that is coming in the world.
So basically, neurodisability, you really can't, nobody can predict if a child is going to have a neurodisability or not. So because it is caused because of number of factors that happens prenatally or during the birth or postnatally. So any kind of complications or risk factors could lead to it. So some things are there which we really can't predict, like if a child is going to be disabled or not, right? So, but we can definitely look out for a few risk factors, and then make sure you are a little taking care of the just preventing it, some preventive measures. For example, when female is planning for pregnancy, they can start taking folic acid tablets from at least 3 months prior to, conception. So that has research has told that taking it is a preventive measure for to prevent all the neural tube defects. So by that, when a woman is still in the stages of planning for pregnancy, she can start off with that. And then once a girl is pregnant, so this regular checkups and the regular scans and the vaccines and all will ensure for a safer or uneventful pregnancies. For example, at the 3rd month, we have something called as a NT scan, which sees for the neural nuchal thickness, we call it, of the child.
Right.
So based on that, we can see if the child has any kind of Down syndrome. And they also do a couple of blood tests, which will help determine a few, any trisomies or any chromosomal abnormalities can be screened for at that particular point of time. It being a first trimester thing, it is relatively a little early for you to take some action regarding the same. And during the birth, in the course of your pregnancy also, like taking few vaccinations, which is regularly recommended by the gynecologist, will help prevent many illnesses in the child, right? And in your stage of delivery, like natal or perinatal we call. So any kind of like using good, selecting good hospital setup with trained doctors, avoiding any kind of home deliveries, which is not happening in the corporate side, but in the urban areas, but still some practices in the rural parts are still there. So, and using septic, like any septic conditions should be avoided, which can lead to any kind of infections and all that. And by taking all these measures, you can prevent a few complications during the birth stage. And the signs you should be looking out for is that after the birth is like the baby has to cry immediately, right? So when the baby doesn't cry immediately, that is a warning sign. So that means the baby's brain is not receiving enough oxygen. So why does a baby cry immediately after birth? Because by that cry, they take up a lot of oxygen, which is uh, transported to the brain, right? So when brain doesn't get that amount of oxygen, there is high chance that it can result in some brain related injury.
Oh.
Right. So, and delayed cry, and then we have to look out for various developmental milestones, like for example, is the baby head standing at the neck holding is there, and is the baby having a social smile, is the baby able to recognize the mother, is the baby rolling over at the correct age that they have to do, and then is the baby talking, is the baby trying to crawl. All these developmental milestones you have to be looking for.
Oh, that's great. So there's a good news because of course you have certain measures that you can take like in that stage before the baby is born also, and then post that also you can do a lot of things, or maybe keep an eye on various things just to make sure that whatever disability, if there's any, you can detect as soon as possible. So that is so great. I just had a follow-up question, and again it could be very basic. So in your career, you would have worked with a lot of children and a lot of adults as well. So can you just let us know what is the age range of people that you've worked with in past?
So I work with toddler, adolescent age group, adults, and geriatric population also. So I am basically a psychiatrist. So mental illness, no age group or no person is immune to any mental illness. So anybody can have any mental health related issues. So I work with all the age groups.
Oh, that's excellent. Thank God we found you, Dr. Pratyusha. No better expert than you. Of course, that brings me to the second question, right? What is the most common illness that you see around this topic, right? What are the most common ones? And we can take that as an example and discuss about those people suffering from that illnesses in the discussion forward. So, what are the common ones that you've seen?
So in my practice, I when it comes to kids, because you're more interested in kids and all that. So one of the most common illnesses that we get to see are autism and ADHD. So there is high prevalence of autism and ADHD these days. So I get to deal with most of them. Most of my child cases are either because of autism and ADHD.
Oh, that's okay. Nice.
And we also see a variety of childhood depressive disorders, oppositional defiant disorders, and then we get to see childhood anxieties, OCD.
Oh, yeah.
So it's
Yeah.
a wide spectrum actually.
So some are like milder ones, like some are the ones that are like not that
Yes.
significant of an impact, and then some are there which has a considerable impact towards a person. Now, yeah, maybe the follow-up question to that is that let's say this person grows up, right? I mean, they certainly need help, right, when they are growing up. Now there are two aspects of help. One is help that you can get at home, right, from your parents or from the person who are actually
Yes.
taking care of that person, and then there's a professional help, right? So as a child, let's say there's a 3-year-old child and we found out that they have probably autism, for an example, right? They can have other than that. So maybe talking from a more generic sense, what are the steps that normally parents take? How is it different, and what is the actual best practice in terms of parents like taking care of their children? And then professionally, what you do from your side in order to make sure that that person gets help?
So I'll just add one
Right.
question.
So the first, yes, you were saying
Yeah.
something.
So adding to what Ashutosh asked, right? So when should parents seek help from professionals? What are the signs and symptoms that they are looking for? And now they decide that, okay, I need to go to the doctor. So what is that phase? What is that realization that you see in your most of the practice that people come to you? So if you can just add both of them and give an answer.
So when we talk about autism, there are a few signs that the parents, I mean, parents any day are the best people to observe the child, because any small change in the child's behavior or anything, the first observer will be a parent. So they need to be very cautious. Like, for example, if we take autism into consideration, so one of the early signs is that the child is not making eye contact while while talking to anybody, and they are not responding to their name. When you call them by their name, they don't really turn. And speech development is delayed. So the child, for example, by the age of 2 years, a child should be able to make a meaningful conversation. But the speech delay is one of the very characteristic feature of an autistic child. And what happens is that in autism, the child really wouldn't be able to connect with other people, right? Like, there is lack of social and communication skills. So, for example, they don't like to be pacified. They don't like to be, when they're very uncomfortable when the parent comes to them, tries to hug the child or kiss the child, and they don't really play or get along with other peer group. And then they don't know, they can't recognize danger. For example, there's the hot pan, you're not supposed to touch that. So they don't really recognize danger, and they will have very restricted interests. Like, for example, any one particular kind of toy or any one particular activity, or they might have any stereotype movements, like, any hand movements, like pin rolling movements, like this. So any repetitive activities, any motor activities which are stereotypical in nature, and such things are one of few common symptoms of autism, signs and symptoms of autism.
Nice. So yeah, so let's say this is from my parents' perspective, right? I mean, parents have seen these symptoms. Now,
Yes.
I think they can reach out to you or probably doctors or psychiatrists to get medical help. Now, we'll take the follow-up question in two parts. You as a parent and then you as a doctor, right? Professionally, what do we do? What are the steps that we take?
So when we have any symptoms, when you think something is not going right, my child should talk by this time, but he hasn't, like, he's been having difficulty in speech. My child is not really being attached to me. He doesn't like when I carry him, or he doesn't make an eye contact. He's not able to ask for what he wants. He's just holding my hand and taking it to me to the place and showing or pointing out the objects that are there. And and the child is not really able to empathize with me. For example, I am sick, but the child really doesn't know that I'm sick, and he doesn't know that he can be a little warm towards me. So these things and all should raise a little suspicion towards the parents, and the first step they do is take them for a professional help, either to a pediatrician or a psychiatrist. So even if you go to a pediatrician, they will be referring you to a psychiatrist. So as a psychiatrist, I would formally assess the child and take the enough adequate history from the parents, and I would clinically diagnose the child's condition. So, and I would refer the child to a clinical psychologist who would make a formal assessment. So in India, we usually use a scale called CARS, Childhood Autism Rating Scale. So that will determine the severity of the autism, whether it's mild, moderate, or severe. So again, see, one thing is we believe in the fact that autism is not a disability, it's a different ability, right? And we function on the same thing. So autism is not something that one person needs to manage or one person can manage. It's a holistic approach. So we will need a team of people to work on a child. For example, we need a speech therapist who would work on language development of the child, to help stimulate the speech, to help the child, with the speech. So a speech therapist plays a very important role. Apart from that, if a child has any kind of behavioral issues, we can either use pharmacological management, that is any mild dose of medicine should also help, along with it behavioral therapy. So a behavioral therapist should also be in our team. And then we will be having occupational therapists. And in case of any motor developmental issues, then we can also have the child go for a physiotherapy sessions also. So it's like a holistic approach. And we would, like I said, they will have restricted interest. For example, maybe a child who's not very good academically but loves painting, his whole world revolves around paints and paintings, and they can do excellent job in that. I mean, they can do really good things in that. So we would try to push the child towards that particular thing so that they would excel in that. There is also a condition called high functioning autism, where they are very, I mean, they just lack in the social and communication skills, but they have an exceptionally good IQ. For example, our Albert Einstein was an autistic, as he was autistic. So, and to know Asperger's syndrome in a better way, I think all of us must have watched My Name is Khan, right? So where Shah Rukh has Asperger's syndrome, but he's exceptionally good at, very good in reading, and he was a very intelligent person. So that is called high functioning autism or Asperger's syndrome, which comes into the spectrum of autism.
That's nice. I mean, the highlight of my day is this is not a disability. It's a special ability that you have, a different ability.
Yes, it's just a different ability. It's not a disability, it's a different ability.
And yeah, totally resonated with your examples there. Like, I wish I had that special ability, or I could be an Einstein, or like somebody who's that famous. Of course, I mean, that's a superpower. Okay, maybe can we follow that up with a success story that you've seen, a case that you've had, like a person you've worked with, which had something like that, and then how did we cope up with that, and what is the success like?
See, again, it is coming back to my same thing. See, autism is not a disability, it's a different ability. So you can't really expect anything that is going to happen miraculously. Like, it is a pervasive developmental disorder, we call it. Right? So it is, when it's a developmental disorder, it can occur because of any genetic changes and all that. So it is not usually reversible. But any mild cases, they can definitely, fit into normal schools, talk a little better with therapies, and then just go into the normalcy life. But it's never about, like, you really can't predict that, or you can't expect that the child will become very normal, like any normal child and all that. So that is something which is like an unreasonable expectation. So the parents should also have acceptance. The first thing what is important is that accept your child, accept their different abilities also, and try to work on that. I mean, it is very disheartening if the parents are expecting that, my child will definitely come out of it. And so we have to, as psychiatrists, it's our responsibility to make the parent understand that this is a developmental disorder, but therapies and all can definitely help them, get a little better, cope with situations in a better way, to get along, like, with their life. And the quality of life and all can be improved. But you can't really reverse an autism.
Makes sense. So yeah, normalcy is like tough to achieve, and or probably can be achieved in lighter cases. But the expectation should be the society should expect them, like accept them how they are, and starts with
Yes.
their parents itself. I mean, we all have seen Tare Zameen Par probably, and then I was furious with the parents how they reacted and all, and then someone like Amir Khan came and rescued the child, and it was a major
See, for
turnout.
example, you can only do one thing. Your skill set has something that you were born with it. Your skill set allows you to do only a limited thing. And you are expected to do only that thing. No matter how much you push the person to do, it's only going to put more stress on the person, right? So you should have, I mean, as parents also, they should have reasonable expectations, and they should know what they can expect from that child.
So
Okay. Nice.
I think Dr. Prathyusha touched a very important point, right? How it impacts the parents, which is my next question on the follow-up. So whenever parents come up with these problems that my child is suffering from this particular disorder, so what are the tips for parents so that they don't get mentally depressed, or they don't have that mental trauma? They should be mentally prepared that if their child is going through it, how should they be taking care of themselves?
Right. So when you break the news to a parent that their child has could be having autism, no parent is going to accept it right away. Right? They will definitely have like 100 questions in their mind. Why me? Why my child? Why? What went wrong? What could I have done to avoid this? But what I want to tell is that, see, there is nothing we can really not predict why it has come, and there is nothing we can do to avoid it, right? There's nothing really that we can do, any measures to avoid it. So first of all, to all the parents, it's totally not your fault, right? So, and the acceptance also, it definitely, first, any parent will be in denial. See, when we hear any shocking thing, or when we hear anything which is an unfavorable thing, so we will all be in denial, say no, this can't happen, no way that this is happening and all that. But we have to give that enough time to the parent also to understand about it, to digest the fact, and then accept it slowly. So once that acceptance has come, they will be able to help the child in a better way, because end of the day, it's the parents. Without parents support, no amount of therapies can do anything at all to the child, right? And in therapies also, it's not about that 1 hour of class that is really going to help. It is what is happening throughout the day, apart from the class, that actually has an impact on the child's day-to-day life. So coming to parents' mental health, yes, we need to give them that enough space and time also to heal from it, right? They have bad news has been broken to them. I mean, like, they have heard a bad news, so we need to give them that time also to process it, right? They need to process their emotions also, and then come out of it.
Got it. Got it. No, so I just had a follow-up question, like two questions actually. One is like how does this person like who has this disability, do we give them their own private space, or just because what I've seen in my like limited experience that I have is they try themselves to themselves, right? They do not, as you initially mentioned, right? They don't have an emotional connection to start with, right? So they'd prefer having time alone. Now, is it pushing them to the wrong direction? Do we take them out from there? Like, how does that aspect of things look like? How much do we like go in their private area, like, or their own?
That is not really recommended, because if you are doing that, I mean, you are just intruding, right? So if a
Yes.
person doesn't want to mingle, or if he's not comfortable in a crowd, I think you don't really need to intrude or try otherwise, right? It's just going to stress them out.
Correct, correct. Okay, so we get them
So
their own time and let them
yes,
be
and we
how
have
they.
something called social skills training and all that. So with the help of all of that, the child might, be a little ready for socialization. We have to give them their own time. I mean, you can't really force a child into crowd. It's only going to make them even more stressful and even more crankier.
Got it, got it. And just to make the conversation more interesting, have you worked with a real life Ishan like from Tare Zameen Par, or somebody who's done really good, or maybe is very good with one thing, right? And you've seen them going the right direction and doing the right thing, not achieving normalcy, because that's not expected, right? You don't. I mean, I am the most boring guy in the earth, right? I don't want to be that. So they have made their life more interesting. Any real case, real life scenario like that?
See, movies definitely they add a lot of dramas and masala to make it interesting. But on the contrary, real life is not that way, right? And from my experience, none of the kids that I'm seeing have already grown up and into their careers and all that, right? So, but again, movies are completely different. The way they portray and all that is completely different to real life situations. Right?
Got it. No, that's a very good reality check. I mean, and people who would be listening to this also, they should be knowing that if they're expecting their kid who has like probably an autism to become an Albert Einstein, that doesn't happen.
So if you want to, for again as a counter for your question, if you say that have I seen any Ishans? So have you on the other side seen any Amir Khan like teachers in the schools these days?
Exactly. And exactly the same thing, right? It was very filmy, right? And as an viewer, right, it affects my mind. It says, okay, I mean, if this person has a disability or maybe different ability, let me find that and push him to that ability, right? Rather than just let him be, right? So the answer is just let him be, right? I mean, just help them where they need help, right? And accept them as how they are, right? Instead of just pushing them to paint a canvas and build something outside the world.
So the scenario of Indian schools are that, like if they have any a small, changes in the behavior and all, they don't really want to take that risk of keeping the child in a normal school. I mean, by no offense, but they have their own reasons for that. But again, yes, usually kids who are autistic or kids with ADHD are usually not accepted into the regular schools in our country.
That brings us to the next topic also. Like how do you think our society is doing in order to like make world a better, like a more neuro inclusive place, right? I mean, how are we placed there? What can we do? And can we compare India to somebody like some country like US and just see how they are doing in terms of creating this neuro inclusive world? So how are we standing in terms of society?
See, one thing is that, yes, though we are getting to listen about autism and ADHD a lot more these days, US had a little more higher prevalence rate from a very long time. So they are very developed in a way that they have very good therapy centers. They have very good people trained for therapies. They have a lot of insurance is also available for many of them, like for the therapies and all that. But in India, it's not like you really, maybe there are a few government aided organizations, but there are really no much special schools or many people the skilled therapists, and that is definitely a limitation when we compare to India and to other developed countries. But again, yes, we every now and then we are seeing new centers coming up and all. As the prevalence of the disorder is increasing, the centers are also coming up. So maybe that's like a positive sign.
Got it. Now, that also triggered one other question, and it is very interesting to me as a layman. When I talk to people from US and in our normal world, I think Pranjal and me, we actually work out like in US hours or India hours. We don't work India hours right now because we work the system. But these guys are pretty vocal about seeing a therapist, right? Or seeing a psychiatrist. They just say that in normal language, my therapist recommended me doing this, right? Then they have a very open culture, right? So like coming to maybe because you are very closer to this, right? How's the culture in India like? And I think like mostly if I tell my parents if they are having something like an OCD, like my mother has an over OCD, right? I would say whenever I place a small glass also somewhere, she'd be like bewildered. and things like that. And it actually is at a very higher instant. But if I go ahead and say that, go ahead and just talk to Dr. Prathyusha, or probably talk to somebody who's good with it, they think that I'm considering them somebody like who's not having his mind is blown out. So yeah, that's still prevailing in India.
So you're talking about the stigma part.
Exactly.
So,
Yeah.
Ashutosh, I would just say, what do you really know about OCD?
I don't know that. I mean, I can only research and see, I mean, if it is normal or
Right.
it's not,
So
right?
in you not knowing about OCD, I mean, nothing offensive or anything, just as
Yeah,
an
no,
example, you said your mom has OCD, right?
right.
One of the common things what we have in our country is that we use mental health illnesses as adjectives.
Oh,
Don't do that. Mental health illnesses are real, just like how your diabetes is real, just like how hypertension or your thyroid disorders are real and biological, so are mental illnesses. Just your regular mood swings are not bipolar disorders. Just you being sad for some time is not depression. Just because you're scared of something, you don't have an anxiety disorder. Just because you like to be clean doesn't mean you have OCD. So stop using mental health illnesses as adjectives, right? That is one of the main things that is leading to stigma in our country.
oh, that's
Right?
point well taken also. And this is very good. And this intrigues me just to know, like, as a normal person, right? I mean, a normal person could also go ahead and see therapist, right? If they are having this problem, right? If anything like this. So what are the key indicators? Let's say if I have someone in my family, uh, so when should we really see it, and whether we should see it like we go to normal doctor for doing a normal checkup also, right? We do it like I do it every year, right? Just to see if everything's going well. Am I going to live for 120 years? So anything that you suggest for a normal person?
So, addressing to your question, there's a very fine line between normalcy and abnormalcy, right? So, everything is all right as long as you don't have biopsychosocial dysfunction, we call it. I'll explain it. Don't just think it's too much to have it and all. So, as long as your biological functions, which means your sleep and your appetite and your bowel movements, your bladder movements, these are not affected. As long as your psychological functions, which means your image of self, any negative cognition like feelings of hopelessness, worthlessness, any preoccupations of thoughts and all that, as long as that is not there, and as long as your social functions, your ability to talk to people, your confidence levels, your interactions with everybody, as long as there is no dysfunction or decreased productivity, you are normal, right? See, for example, take depression. And what is the difference between depression and being sad, normal sadness? See, if you are sad, if you're sad about a thing, you might feel bad for like maybe a couple of hours or maybe a couple of days also, but you will eventually come out of that because your body is designed in a way to react to stress and come out of it, right? So a normal human mind or a normal human body can react well to stress and come out of it on its own. But when it is a depressive disorder, which is like a biological illness, right? So what happens is that pervasiveness, prolonged low mood for at least 2 weeks, we need to diagnose a depressive disorder. Like, you don't really know why you're sad, but you feel very dull throughout the day for most of the time. You don't feel like doing anything. Like all the previously pleasurable activities don't seem to be giving you any pleasure at all. You're feeling tired throughout the day. I mean, without doing anything also, most of the time you're tired, right? That's called easy fatigability. And constant feelings of hopelessness, feeling very worthless, feeling that there's no help available and there's no end to the situation at all, and then having death wishes, suicidality, appetite changes, sleep disturbances. So it's a very huge thing. It's not just sadness, right? It's when it is a depressive disorder, it's a lot more than just a normal sadness. So that is when you need to get professional help. By professional help, I mean a psychiatrist, a doctor who's trained to diagnose and manage your mental illness, right? They need to be approached first. So we would clinically diagnose the patient and rate the severity, whether it's a mild depressive disorder, moderate, or severe. So based on that, we might recommend, like if therapy alone can help the person. If it's a mild depression, then yes, therapy alone can help a person. So, but if it's anything between moderate and severe, definitely medicines have to be added, because anything that happens, see, why does depression happen? When the hormones, there are few neurotransmitters in our brain, right? When those go down, a person's ability to cope with stress will not be there. So as a result, it will lead to a disorder, right? So just for example, I mean, like there is thyroid hormone and it produces thyroxine hormone. So when it's not, the thyroxine hormone is not being produced adequately, a person can go to hypothyroidism. As a result, they might, have changes in the weight, changes in the menstrual cycles, hair loss, many such symptoms. So how do you treat it? By replacing the hormone, right? You give them oral thyroid medicines. So this is also as good as that. Why are you getting depressed? I mean, like, is there a life without stress for anybody? All of us are stressed, right? Or like, for some, getting up from bed is also a big stress. So all of us are stressed in our own way. But how some people are able to react to it, and then they are able to go on to their normal lives. But why some people are not able to do that, they're having dysfunction, is because their bodies or their minds are not able to cope with it. That coping mechanism is failing because of so many things happening in your body, like the hormones, your neural circuits, your brain circuits, all that. So when it is at that level, you don't really know, you can't just say that, counseling or therapy, just talking to a person is not going to help, right?
Nice. Yeah. I mean, that is great. We know about that now. Of
And
course,
one more thing that I wanted to say,
yeah.
which is like quite interesting, that most of the people have a common doubt, like, should we go to a psychiatrist first or a psychologist first? Right? So that's a very common question that we encounter. So let me answer to this question by asking you another question. For example, a person is having a stroke, brain stroke. Would you go to a neurologist first or a physiotherapist?
Neurologist.
There lies the answer, right? See,
Yes.
definitely therapist, physiotherapist, or a psychologist, they're very, very important, right? So we usually work as a team. But when there is, in any case of illness or when there is any abnormalcy, the first point of contact should be a doctor, right? So like if a brain stroke, they first go to a neurologist. So based on the timing, like how long has it been since the patient has had a stroke, so based on that, they design, like, a treatment plan is formulated, and then the initial treatment stabilization is done, and then they are referred to a physiotherapist for further recovery, right? So you don't directly go to a physiotherapist for a brain stroke.
Got it. Nice. And just one other doubt. This is just for curiosity, and I think people who would be listening and they'll also have one question. Let's say if I am going through a rough phase, okay? I'm going through a rough phase and I am having stress in life. Let's say my office gives me a lot of stress, and then just to make conversation more interesting, my wife gives me a lot of stress, and then what so like everything in the world is turning around, right? I don't want it to. I know it sometimes it comes naturally, and I'm not able to cope up with that, and it's very natural that happens, that I go into that loop, and then in that depression, and then it goes ahead, and where I need some help. But anything that you'd suggest to a person who's going through a rough phase or probably is having stress, right? You said like body can naturally come out of it. So anything that
Yes.
I can do in order to make sure that I can come out of it.
See, once you're into a disorder, then there's nothing that you can do, right? But like I said, prevention is better than cure. So all of us, all the individuals need to keep a check on our mental health every now and then, right? So please take regular breaks in between your work. It's not like, don't keep working monotonously. Don't keep giving lot of stress to your body. Don't make it very overwhelming for it to cope up, right? For example, I'll just give you an example of a phone. You use your phone as per like how it needs to be used, it will go on for a very long time. But you abuse it, you use it like continuously from morning to night, it will definitely die off soon, right? Sooner than expected. The same thing with our body. Just because our body can react to stress doesn't mean you give it so much stress that it becomes overwhelming for it.
Oh,
You need to definitely give enough breaks and accept work which you think is healthy. Like it shouldn't be like too much over accepting a lot of work that you can't really fulfill, and then taking the stress of not being able to complete it, deadlines and all that. So plan your days and your work schedules also according that it doesn't become very overwhelming or very overburdened. And like when I meant breaks, try to connect with more people. Human connections are very important. For example, you're in the office, you're working for a very long time. Just ask your friend out for a coffee. Just go have coffee, talk about any lighter things, then come back and sit back for your work. So taking small breaks, human connection actually, what I mean, this is not just saying, but because of human connections, what happens is that our brain releases a hormone called oxytocin, right? Which is again a feel good hormone, a hormone that allows you to bond and all that. So when that gets released, it makes you more happier and more confident also. So human connections are very important. Socialize with people, take breaks in between, pamper yourself, like go for regular, like any spas if that may relax you. Focus on your diet, because again there's a lot of connection between the mind gut. We call it the mind gut connection, right? So what you eat also has a very big impact on the way you feel, right? Try avoiding processed foods and packed foods. Let me tell you one interesting thing. So a lot of people would ask me that all this stress and all, why in this generation, previously and all, my parents, our grandparents and all, they never felt so stressful. They didn't feel the need to actually go to a therapist or a psychiatrist. Why has it increased now? So let me tell you one thing. What we see is that, see, the food we eat today is not very of good quality. The air we breathe is not of good quality, right? And the way we connect with people, that is also not there. So all this is definitely going to affect one's mental state. So if you see in the olden days, they used to grow, there was no like so much pesticides and all, it was mostly organic farming. So they used to eat everything, like all fresh food they used to eat. They used to have a lot of physical activity. It was never like sitting at one place and not doing anything at all. They would work for their living, right? Everybody was physically active. So and they used to breathe very like good air. There was no so many vehicles, no so much pollution. So when there is a lot of things happening around us, a lot of things, life was not so competitive before, like it was not a race like how it is now, right? They had a more relaxed, and they were all in joint families, which means there was a lot of human connection, a lot of people to talk to. It was like not unlike now, it's all nuclear families where each of us are on their own phones, right? If it's a family of four, all the four people are on different gadgets. So the life was also not like the same before. So as we progress, as this as we are progressing as a society or country, the diseases are also progressing. Like for example, diabetes was not so frequent too when we were very like in the past generations, as much as it is now, right? So the same way, even mental illnesses are also progressing.
that is correct. I mean, sometimes my mother or my father do not understand the concept of depression also. They just say, what is this? Why are you guys this just stress and just go out, play and go out of the phone and then do it. I mean, it's a real thing, and it is like when it develops, it's a real thing. But of course, as you just mentioned, right? I mean, creating a healthy lifestyle or maybe focusing more on your like pampering yourself and making
And
sure that you're happy, it brings a change. Yeah, please go ahead.
physical activity is also very important for good mental health.
Oh, nice. should, I mean, with this remote work going on, I mean, you don't have people around also. The best friend is phone, and you are located far off from your place also. Like I am from UP and I've come to Hyderabad. So probably I'd be, my closest friend is phone, right? So I'd have to make sure that I go out and then I play and I make sure that like whatever I feel like, which keeps me more happiest, I invest time in that so that I can at least be less in a less risky place and cope up with stress better. That's great. These are the questions that I had, and I think thank you, Dr. Prathyusha. I got a lot of good things that I can work with, and a lot of interesting answers that you've provided me, and you've really broken some of those shackles that I had in my brain or my misconceptions that I can really like show to the public, and they'll be aware. Yeah, I'll pause there. Maybe Pranjal, if you had any follow-up questions.
I don't have a follow-up question, but as Ashutosh said, right, we had like a lot of good takeaways from this conversation. A lot of things that you told us we were not aware of, and probably the audience that will go through this video and will have the clips of it will surely be benefited. So thank you, Prathyusha, for your Dr. Prathyusha.
Thanks to you for giving me this platform, at least to, this is something called knowledge sharing, right? So I'm really happy that I got this opportunity to share some things which are very needed right now. We need a lot of people to understand because they're all suffering. Many people are suffering silently.
Correct.
So they should be aware that help is available. It's just one step away. All it takes is that just, take that step forward, put aside the stigma. It's not going to help you in any way. But taking help surely does. It will improve yours, and the whole family's quality of life will be improved.
Correct. And I think, yeah, I mean, one part of it coming from a professional is good. I think I can also speak on behalf of my fraternity, or maybe Pranjal also, that since we are aware more now, and we have got this and we are creating awareness, I think we as a society also, or if I am able to influence society more and have greater positions, I'll make sure that I create a very neuro-inclusive world, and then let people maybe be comfortable with whatever different ability they have, and or if they're suffering in silence, they can come out and then really talk to us. So I mean, that responsibility also partly lies with us as a society as well, and we'll definitely try to make a change and see wherever we can make an impact as well.
Yeah, so as you said,
so if you want to really make an impact, I think you as software guys should probably take up a step. That, like, what I see these days is that software companies are hiring people like life coaches, wellness coaches, to address mental health issues. So let me just tell you one thing, that see, diagnosing or treating a mental illness is definitely not in their scope.
Correct.
Right? You need an actual mental health professional to be able to diagnose and treat a disorder. I mean, yes, wellness coach, the role of wellness coach is very well defined, that they help with the day-to-day goals, your work goals, your relationship goals. So that is for a normal person to achieve their goals, they will be helping. But for a person who's clearly having any kind of mental illnesses, they definitely need professional help.
Correct. And that's correct. And we should know that, I mean, there's a stage to it, right? I mean, yeah, as you mentioned, right? You not go ahead and like you need a neurologist and then the therapist. There are two different jobs, right? And we should be aware of which stage we are in and what problem we have. And there are different people to reach out to. So awareness also brings like, whom do we want to reach out to? It's just not that you're just talking to a therapist and everything is solved. Probably the therapist will redirect to somebody.
So what is going to happen? Let me just tell you, like, for example, a person is severely depressed, right? And they opt to see a therapist or a psychologist. So they are not qualified to prescribe medicines. But definitely, as per guidelines, a severe depressive patient will not benefit from therapy because their concentration levels are so low, and if you can't expect them to really sit through your conversation, and it's not really going to help. Right? Because like I said, the problem is at the level of your brain hormones and your brain circuits. So just by talking or just by therapy, it's not going to be solved. So when the person is suicidal, they don't get that adequate help, or that crisis is not intervened medically, then there is high chance that that patient can go for, like, they will attempt or complete a suicide. So that is a very big risk. Had it like if they come to a psychiatrist, that can be avoided, because we can diagnose the patient and then tell them that, okay, you have severe depression, so you have to take the medicine. Medicines are the only things that is really going to help you. We try to educate that person and give them, right? So one thing, Ashutosh, survival is every human's instinct, right? So all of us, we strive, like every, not only human, every organism's instinct is survival. So all of us are driven towards that. Anything on the contrary is an abnormality, and by a medical professional.
I think, are you able to hear me, Prathyusha? Because your screen froze for a bit. But yeah, I think we've got the answer covered. I think we've almost reached the top of the hour.
Yeah.
If you're fine with just answering last question.
Sure.
So the last question is, we've covered everything, right? Like from top to bottom around patients. I would also wanted to touch upon, for those all audiences, right? People who are very young and wants to take up this as a profession also, right? I mean, they'd be also looking at you and then getting inspired and like seeing like if they can also make a contribution directly by being a professional. So how's that layout, right? How is that layout right now in India? And then is it a rewarding career, and how is it growing, and what impact you can create? Is it just me?
For people who want to pursue mental health related careers in their, like, one thing I would advise is that please go for it only if you're passionate about it, because it is a very difficult, branch that, it's not so easy, and without passion, you really can't, flourish in that. So that is one thing. And if your personality is such that you're naturally an empathetic and, compassionate person, then I think you must pursue it. And for a psychiatrist, again, the sad reality is that if you only if you're passionate about it, you will be able to sit through this profession, because there are a lot of challenges, more than any other profession. There are like so much you need to deal with, the day-to-day stigma. You need to deal with stigma amongst the society, stigma amongst the other professionals, other doctors. So there's a lot of stigma around the profession, and you have to deal with your own family members. It's like a big task to convince them that you would want to be a psychiatrist. So you'll be getting all sorts of comments like, I don't want my child to be called as a mental doctor and all, like a lot of, again, unwanted things and all. So if you're strong enough to, face all of that, and you're really passionate about it, I think this is a career that will, if you're really passionate, you will definitely do great in it.
Nice. And best part is you impact a lot of good lives and then help the people. I think that's
Right. So it's like you don't only impact the person's life, but you improve the quality of life of the whole family.
That's true.
That is the beauty of the subject.
nice.
So I guess my two takeaways from this entire conversation was awareness and acceptance. If we just can work on these two things, we can make life better for everyone, and that create that neuro-inclusive world that we have been talking about.